Hi everyone, this is Kelsey with the Adams County Health Department. I'm just going to briefly go over how to do a take-home self-swab kit. So if you're getting the kit at the clinic when you receive treatment, it's going to look just like this. If you get it from the mail, it's obviously going to be covered with a mail package. However, once you take it off, it will look the same. The kit should have a please complete on and then a date written on here. And this is going to be 3 months after you receive treatment. Once you open these kits up, on the inside lid, there's a QR code, and that is a patient satisfaction survey. It just tells us how well you think that this went, if this was convenient for you at all, and if you would want to do it again. Inside the kit, every kit will have 2 instructional pamphlets on how to label and register your sample and a reminder on how to mail your swabs. Each kit is going to have different swabs in them, and they're going to be specific to the site that you will be using. And they're either going to be oral, urine, vaginal, or rectal. I'm going to go over the oral kit really quickly, and that is going to be basically true for how you're going to complete the vaginal and the rectal as well. All of these kits are going to have a outside bubble wrap. They're going to have a biohazard bag. They may or may not state on the outside what site you're going to be testing. They're going to have the swab themselves, and the swabs are going to look the same for vaginal, rectal, and oral. They're going to have a laboratory slip just in case the QR code does not work. And then they're going to have a site specific on how to collect that sample. They'll also have this QR code and a corresponding barcode. And then they're going to have a paper here that's just to absorb liquid just in case the test tube is not sealed properly. So you're going to open up one of these kits. This one is oral. You're going to look at how to do the collection, and this is going to be the exact same with how you self-collect in the clinic. You're going to notice that this has a tinfoil wrapping on it, just like all of the ones in the clinic do. Do not pierce through this. If you pierce through this, the lab will not run the specimen. Within this, it's going to have this blank piece, and then it's going to have the collection swab. So you're going to wash your hands, and then you're going to open up this collection swab. You're going to take this out and make sure that the tip does not get anything else on it. So you don't want this laying down. If you do have to lay this down because you have to do something, make sure it goes back as cleanly as you can back into this paper wrapping. But you're going to test yourself just like what the kit would recommend. And then when you're done collecting your sample, you're going to twist open the test tube, hold this with your finger, take the Q-tip, put it down, and then you'll see this little notch here. That's a self-perforating notch. So you're going to grab it and then bend it over. It's going to snap off. You can put that down. And then you're going to put the lid back on and make sure to screw it really tightly. It's going to be really important that none of this liquid comes out, or else they will not run this kit. Once you're done with that, if you have multiple kits, I would go ahead and put this barcode on it so that you know which one went to what. Once the barcode is on it, to put the barcode on it, you're gonna make sure that you don't cover the lot number or the expiration date. It's best to probably put it where the patient name and the patient ID would be. And then you'll notice on this barcode, you should have this pre-filled out with your date of birth, your first name, and your last name. If this is not pre-filled out, go ahead and fill it out for yourself. You're going to go ahead and finish all of the testing swabs that you need to do, and then you need to register your sample. So this QR code that's attached to the barcode, you'll notice that they're the same numbers for the kit ID and the chain number. So just in case you get mixed up, if you have multiple swabs, you'll know which one to register. You need to register your samples within 20 minutes. That way it gives the lab an idea of when you're time stamping or when you actually did the swab. So in order to do the QR code, you're just going to scan the QR code, with your phone, and then it's going to prompt you on how what your name is, what your address is, your zip code. That way that you can register this sample with what you did. Once you registered it, you don't need this QR code anymore, but each site, so if you have multiple sites, each site will need to be registered. Once that's done, this is completely done. You can then take this test tube, make sure that the lid is nicely screwed on, put it in the biohazard bag, close the biohazard bag completely, then take this and then you can fold this in half, put it into the bubble wrap. You're gonna take this off and then close this completely. That way it's ready for transport. If the QR code for some reason did not work, then you're going to fill out this laboratory slip and then you would put it in here as well. Just make sure you write down the collection date and time so they know when the sample was done. And then that is going to go into the kit itself. I'm also going to go over how to collect a urine sample because that is not something that you do in clinic. So it's going to have the same thing. It's going to have the bubble wrap, it's going to have the biohazard bag and how to collect the specimens, as well as how to do the testing yourself. This one is yellow. That should be an indicator that it's urine, and it's going to have that piece of paper underneath it. And then I did not fill this out, but it will have a pre-filled out barcode that you're going to use the same way you did with the oral. So I already pre-filled this red tube that you're going to get that's going to come into the kit. Don't worry, it's not urine, it's just colored water. So you're going to wait 2 hours before peeing, and then I want your first urine. So I don't want you peeing outside of the cup and then peeing into the cup. I want your first urine. It should be pre-marked on how much urine we need, but we need anywhere from 20 to 30 milliliters. So you're going to pee into the cup, fill it about to there. If you do a little bit more, that's totally fine. Then you're going to do the same thing where you open this up, and then you'll notice that instead of a swab, it has a pipette. You can just put that pipette in there, and then you're going to take the test tube out. This will have 2 arrows, and that's going to be where you need to fill the urine. So you're going to open the test tube just like you would with any other swab, and then you're going to squeeze down on the pipette, put it into the urine, and it should fill up. And then you're just going to put this in and fill it until it gets to that specific measurement. And then once it's there, you can just keep the pipette there. Make sure to put your lid back on, screw it on as tightly as possible, and then you're going to put the barcode onto the sample and then finish it the same way that I showed you on the urine. So it's going to go in here, that's going to seal up completely. You're going to put it in the bubble wrap, that's going to seal it completely. Once you're done with that, this can just be thrown in the trash or put the urine in the toilet and then throw it away. Once all of your samples are done, you're going to take this last piece out. This is your prepaid postage. You're going to put your sample in. It's nicely protected, so you don't have to worry if you only have one sample and it's kind of, moving around in there. Close up your bag. This will come in a self-sealed bag. So you're going to put this in the self-sealed bag. And then take this off. Close up your bag. And then it is ready for transport. So this is through USPS. So you need to take it to a USPS site. If you are unable to take it to a USPS site, you can also do this QR code and then you schedule for a free pickup at your home. Because it's cold outside, we don't want these samples sitting in the cold because it may not give us the best results. So I want you to take it inside. You do not have to stand in line because this is already a prepaid envelope. You just need to put it in the indoor prepaid postage or hand it to the postmaster. You don't need to stand in line. I don't want you to stand in line at all. This is going to go to the state lab, and then we're going to get the results, and we'll give you a call when we know what those results are. If you do have any questions, or if you're stuck on how to do this, please give us a call. We're happy to talk you through it. And again, our number is 303-255-6222. Thanks so much for watching.